I was like, what did I get myself into? This is awkward. This is uncomfortable. They don't feel right. I'm not identifying them as me.
Today, I'm joined by Michelle, who's had her dental implants for almost 4 years, to discuss the initial struggles she faced while adjusting and 3 mistakes to avoid when getting dental implants yourself. So, Michelle, let's talk about after you had your dental implant surgery and then you had your teeth placed. What are those initial challenges you faced? What did they first kind of feel like in your mouth? Did it feel weird?
Actually, okay, so I have like the perfect example of this because I can remember talking to my family about it. You know, Darth Vader's helmet?
Yes.
It felt like that, honestly. Just awkward and weird and big. And it just felt really unnatural. Like I felt like it was odd because I couldn't really feel anything. My tongue was numb, but it just felt like I had like this weird placement in my mouth. It just felt really unnormal and unnatural for what, I mean, I had no teeth before that. So it was a big change for me.
Right. Well, what about, after surgery, were you feeling discomfort with it as well? Because I mean, you're like, what the heck is in here, and swelling, I guess.
Well, initially I didn't really feel a whole lot because they did have me under anesthesia. The next day, I got home late that night, slept, sitting up. The next morning I woke up and it was definitely more sensitive. The numbness started to wear off. I had medication, so I was doing that consistently. The swelling, you could start to feel the swelling really settling in. And that is a whole level of awkward too. I look like a chipmunk. Yeah, I don't want to say it was incredibly painful because it is a surgery, and discomfort and pain anytime you're cutting into your body or doing things is expected. It was manageable pain wise. I would say that the biggest part was just the uncomfortable of having this whole different thing in my mouth. It was very, very awkward. They felt like they didn't fit. I couldn't feel where my lips landed. I couldn't recognize where my teeth hit each other because it's like now it's very normal. But then I couldn't tell where my teeth were placing. It was just like I bit my cheeks a lot at first, and I bit my tongue a lot at first. But it was took some time to get used to. Not too long, but it did take some time.
And what about like any struggles with the talking or even eating aspect at first?
Same thing I mentioned before, the placement of my teeth. I didn't quite know where they landed. It felt very unnatural to have them line up and place themselves. So I did bite my cheeks a lot. The eating, I didn't really eat a lot at that time. I was doing mostly protein shakes. The talking, so when I was 14, I got braces because that was before all my teeth went to heck. I had braces, and after I got my braces off, they gave me a retainer. And you have that like lisp, a lot of buildup of spit, that uncomfortable awkwardness as you're trying to learn certain sounds like S and T. And that's exactly what it reminded me of when it came to my speaking, was a retainer. It just felt like I had a retainer in my mouth again, other than it was much bigger than a retainer. But the speaking aspect reminded me of a retainer. And that actually, just like with the retainer, if you continue wearing it and practice, it dissolves really quickly. Like the speech clears up probably faster than the biting your tongue in your cheek.
Did you have any struggle like maybe getting food stuck in there or the maintenance of them at first?
Oh, I'm sure. In the beginning, there was quite a bit of gapping once the swelling started to recede. And yeah, I did. I had lots of food. I'm getting stuck in. Can it reminded me of braces? You had to always get something stuck in there.
Right.
It wasn't uncomfortable. It was more just a self-conscious thing. Like it felt like if I know it's there, everybody else must know it's there. It was an issue, but it wasn't at the same time.
Let's actually dive into those 3 mistakes to avoid when getting dental implants and how they helped you overcome your struggles that you were facing at first. So the third one is especially important, but we're going to start with the first one, which is thinking you'll know how to use your teeth immediately. This is a major surgery and your body, it's not going to adapt to it right away, right? So can you describe, can you speak on that a little bit?
Well, yeah, I think it's with anything that you put into your body that is not what you were naturally given. For instance, a hip, a knee replacement, hearing aids, anything that you put into your body that you are not accustomed to, used to, isn't part of you, is going to be awkward and uncomfortable and probably give you a little bit of anxiety at first because your body's fighting against it. Your mind is fighting against it. Do you know what it reminds me of? And I've thought on this a lot because I like to be able to explain it to people in a way that maybe they could understand. I'm a runner, not so much as I used to be, but I have done a lot of running. And when you buy a pair of shoes, usually they're not comfortable. You don't go buy a brand new pair of shoes and put them on and wear them in a marathon the next day. It would kill your feet. But if you continue to put those shoes on one day and they hurt so bad, you're like, oh my gosh, I'm never going to get used to these. These are so uncomfortable. They're so awkward. But you keep putting them on because you know you're going to break them in. And then one day you put them on and they feel so natural and so good and fit your feet so perfectly that you forget all the discomfort you went through in the beginning. You're like, these are the best shoes I've ever had. And so that's literally how it feels with my teeth.
Absolutely. And well, do you have any, tips or advice that maybe you did when you were adjusting, like something like maybe talking out loud? Was there anything like that helped you practice with your new teeth?
Yeah. First of all, you want to get a support system, people you can talk to that understand, hey, I just went through this, and you can talk to them like I'm talking to you. They know your situation. You're just talking to get practice in a safe place. Talk. Talk to your kids, talk to your animals, speak. I've seen people practice like Sally sold seashells down by the seashore type thing,
Yes.
Come up with these rhymes, things that get your lips moving and your tongue. And the biggest thing, singing is great. I sing out loud with my headphones on. No one else can hear the music. I crack them up, but it helps. You've got to get your mouth used to moving around these new pieces in your mouth. The faster you do that, the faster you're going to adjust.
That's awesome. I can just picture you with your headphones. I do because I do the same thing. I'm at home alone, but I'm like, can my neighbors hear me?
I'll be right. My kids will be like, Mom, I can hear you singing. And I'm like, yeah, I don't sound, I'm not a singer. I'm probably harder on myself than I need to be about it, but it cracks them up and makes everybody happy. So I'm like,
Oh, that's amazing. Another thing that you pointed out was, like you said, not everyone's going to heal the same. Not everyone's going to have the same amount of bruising or swelling or discomfort. It's all going to be different for everybody. So can you kind of talk about a little bit more of your pain and how you were able to, I guess, manage it and how long it lasted, I guess?
Yeah, actually, I can give you a comparison because Carrie, my husband, he went in 4 months before me and got his top stuck. He only did Tylenol and ibuprofen and had swelling, not much, was back to work in 3 days. He's a general contractor. Never took any narcotic pain pills or anything, just ibuprofen and Tylenol. Minimal swelling, minimal pain, back to work. Me, I took 2 weeks off work, but I also had the tops and bottoms done. Everybody's different with that. If there's bone graft, I mean, there are so many different scenarios you have to take into account. I think the swelling probably after the initial numbness wore off was more of an issue to me than discomfort and pain. You feel so weird. It's like really weird. You're bruised. It looks and feels worse to you than it does the outside world.
Mm-hmm.
But like I said, our minds mess with us.
Exactly.
Yeah.
Well, and another thing you mentioned earlier was, you said it felt, very unnatural at first. So, I mean, obviously, this is, like you said, a foreign object, but when did it ever, if ever, did it start to feel like more of a part of you or normal?
Let's see. So I had my surgery done in December, and then I got married in April. And I remember, and I'm sure it happened before that, but April was when I had a lot of photos being taken. I had different profiles being taken, and seeing that and being able to speak my vows in front of all those people, I I noticed it for real then. I think it's because it was so public. Like I had cameras and videos and speaking and getting married, and I think it really set in then, but I knew it before that. I just think that was like a huge epiphany for me. Like, wow, I'm standing in front of all these people, reading my vows, smiling. Like, I've got pictures of like, I'm like, like laughing from the side. And looking back on those, I was like, I mean, I seriously can't stop looking at my mouth. Like, oh my gosh, like that's me. They look natural. I Nobody there could tell. I mean, if I didn't tell people, they would not know that I had implants.
Oh my.
They don't, because I don't sound like it. I don't. They look very natural. They don't slide out like dentures, so they're very, very secure. I could eat normal. I could eat at the wedding, and it was just. And by that time, the swelling and the like the 2 week had gone by and the other checkups, and so the gap between the implants and the gums was drastically less. So the amount of food that was getting stuck in there is, I mean, now it's more like a raspberry seed, maybe a raspberry seed, or just the tiny little seeds that get stuck in there. And sometimes that requires water pick. Depends on where it's at. Or just a swish of water.
Right. I'm like, I still get popcorn kernels stuck in my mouth and I can't get it out for the longest time.
Kernels are bad because they coddle your teeth. Like,
yes. they're hugging your teeth. And that leads me to mistake number 2, which is avoiding hard foods right after surgery. And why is this important? Well, let's actually have a doctor explain it.
Dental implants take approximately 2 to 4 months to fully osseointegrate with your body. Some patients can get impatient because after 2 weeks, the implants probably will feel fully healed because the soft tissue is closed up. Everything looks good, feels good, but really the bone is integrating with the implant. That in itself takes 2 to 4 months. And if you're eating beef jerky, if you're eating steak, if you're eating hard nuts, crunching on ice, then that can create a lot of micro movement with the implants, and those implants will not be able to integrate with the bone.
that's huge. That's a huge word. That's so important.
It's a big word.
I see people on this, bless their hearts, on the Smile Maker page. I feel great. And I'm like, oh my gosh, what about what? That's like I love that. I want that word sent to me because I'm going to post that. This is why you can't. It micro movements, which makes them not like cement. If you go, my husband is a general contractor. If he puts a post in, like we built our fence for our dogs, if it didn't harden correctly, when the wind, when anything, they wiggle.
Right.
They're not like, but cement, if you let it dry correctly, it's so, I mean, it ain't going nowhere. So solid. Whoa. I don't question the doctors. I know they've gone to school and done their time in that and they know what they're talking about, but to know in his words, that's bad. That's fantastic. I want that word.
There's also different types of dental implant procedures, right? To where you might be on a liquid diet after, or you could be on a soft diet. So it's best to know what your provider is telling you to go on. So can you kind of talk about at Nuvia what diet you were put on, and I guess how you your process of kind of getting used to the food and practicing eating?
Yeah, so I was not eating very much before my surgery because I didn't have many teeth, so I had to chew a lot in my uh, I remember drinking a lot of smoothies, the muscle milk, protein shakes. I think I was afraid of hurting something. They didn't so much give me, I mean, I knew I could eat soft food. They mashed potatoes, they said were really good. Trying to think of what else they said that didn't require a lot of chewing. I know mashed potatoes, soups were really good. I ate a lot of
Yeah.
smoothies. As a matter of fact, I drank so many smoothies. I'm not really a big fan. I still
That's
like them
fair.
occasionally for protein, but it's not like my go-to because I did drink a lot of them, and I was scared. I wanted these for so long, and I visualized and dreamed about them for so long. I didn't want to do anything that could mess it up. So I'm
Uh-huh.
sure I waited way past when they said I could, but I know I didn't bite into an apple or eat nuts, chew gum. I didn't do anything like that for quite a while. Not necessarily because they said not to, but because I was scared. I didn't want to hurt anything. I'm
Right.
overly cautious, which has been very, very beneficial. 4 years out, almost.
Well, now let's get to the most important mistake. Mistake number 3, which is not knowing your dental implant timeline. There are different types of dental implant processes. Traditional way of doing things, which Michelle, I'd love you to talk about some of your friends that have gone through, longer periods to get their permanent set. But you went to Nuvia and, well, let's let you talk about it because you had a different experience than others. So, but not knowing your dental implant timeline, you have to know that because you want to know what you're walking into, how many appointments you're going to have, how long is this process going to last.
And I think they do a really good job in informing you. They're very clear with you from the beginning. So when I went, they had a different system. They put temporaries in my mouth, which felt like Darth Vader's helmet. That was really weird. It's so weird. I can remember it's all weird. Um, I mean, they were beautiful, but I knew that at that time that those were not my permanents. That I would go back after my mouth healed, and like I said, I don't remember the timeline because it was so long ago, but I knew that they would be done before my wedding. So it would be within a 3-month period from the time I had my surgery, because that was the whole goal, was to have our teeth done for the wedding. And they
Right.
knew that, and they worked with us. So I went in at my 2 week, and they heard me, they listened to me, and then they gave me a proposition. They said, so we have this new technology and we would love to try it on you. Are you willing to take this journey with us? And I'm like, what is this? He says, 24-hour teeth. He says, at this time tomorrow, you will have your new teeth. And I was shocked. Shocked. I was like, okay. And I really didn't know what to expect from that, but so far so good. I mean, they had not done anything that would have made me not trust what they were saying. They heard me, they listened to me, they validated me. They never shied away from my phone calls or my concerns or my worries. And I probably called an obsessive amount. I'm all about, like, you have an issue, call Nuvia, and I tell you, they will not get tired of hearing from you. They love you. They really do. They care about you. And so I went home, came back the next day, and they placed these.
Like you got to experience that for like one of the first people to experience that.
Yeah, it was new technology, and I got
One,
it. And I'm not kidding you. They freaking knocked it out of the park. I get the response so much that my teeth look so natural. They look like even how they're a little bit longer in the front here, and they look so similar to what my original teeth should have looked like had they not. But I mean, I don't. I just. They did amazing. They really just made my dreams come true. Then they fixed it. But as soon as they put these in, I could not stop taking selfies. I, I mean, I could see the timeline on my phone because it's like, just a couple, then I'm like, filter, non-filter. And it was just,
oh, That makes me so.
It's amazing.
Regarding Nuvia's 24-hour process, how do you think that helps with, the adjustment period? I mean, you would think since you're not going back and forth, like getting a bunch of adjustments going on and stuff like that, you would think it would help with adjusting, right? I don't know. What are your thoughts on?
Oh, absolutely. Being able to see your teeth the way that they're going to be for good, adjusting to them right off the bat. Because I see people on the Smile Maker page and they post a photo. They're still bruised, they're still swelling, but their teeth are so beautiful. They're so beautiful. And when you can see that permanent finish, even around the swelling and the bruising, it makes it like that. You can be that much more patient because you can see it already. You've got that visual. You're like, whoa, I know I'm swollen and I have bruising. Oh, look how great my teeth look. Wow. It's like, and then from there, it just gets better and better because as you start to lose the swelling and the bruising goes away, you could see these beautiful teeth that are permanent. They're not going anywhere. They're, and some people live far away. It's not easy to get to the dentist, or they've got jobs. It's hard to take time off work. The timeline of it is huge. Being able, I've seen it on this dental implant page that I follow. These people, they're waiting months. I like this new technology. It's pretty amazing.
Oh, that's amazing. I do before we get to some of these questions from the Smile Maker Club. I'm sure there's a lot of people curious about the cost.
So cost is a big issue for people because when you're going to the dentist, say you're going to the dentist to get a root canal, it's like $1,000 here, $1,200 here, office visit. But if you do the math of it, for me, I way overspent trying to put Band-Aids on things that were breaking than what I spent on my permanent smile with Nuvia. Way. Not to mention the anxiety and the stuff. So my advice is, get a jar, get a coffee can, start putting money in there, everything extra, if, by small and simple things, great things are brought to pass. And I am by no means rich. I'm lower middle class. I had a dream and I started working towards it by small and simple things and had faith and trust and belief that I deserve this. And I visualized it every day. It's just an investment. And if you're going to the dentist and you're paying just a little bit here, a little bit here, a little bit here, do the math. I'm not kidding you. It's crazy how much root canals, crowns, fillings, everything costs for temporary. They don't last.
Mm-hmm.
They don't last. I have paid so much money. I mean, my husband too. He had paid so much money on it. Get a savings account. You know what? Uber. I've heard people get Uber and anything they make from Uber, and you make your own hours. You could just decide, I'm going to do 2 hours a day. Put all that money into this tin can. You can work with your bank. Take 5% out of my checks. Put it into this account. You don't even see the money. It's just like a savings account.
And the cool thing is the dental implant cost guide has examples of people just like you, Michelle, who paid for this procedure. And along with that, you can get an idea of what the cost could look like for you. So if you're watching, you can download that cost guide in the description below.
The payments plans are there. There are options. Like I said, in my mind, I would have been the least of a person to be able to get this. For me, I was like, that isn't going to work out for me because and I'm not putting myself down saying this, but I'm basic. I'm just a basic person raising kids, living on a corner of Arizona, working a couple days a week at a warehouse and going to school. Like, miracles happen. There are ways to save that money, and it's worth it.
Wow.
It's worth it. I can't even begin to describe everything changes in my life since making this investment in myself.
And you did that. You made that happen.
No, and I was so scared. I didn't believe I was worth it. I didn't believe it would work out for me. And it did. That's what I'm saying. If you have those feelings, that's just your freaking annoying mind trying to keep you safe, but step out of your comfort zone. Because my whole life is so different now because of this. I'm going to school to be a counselor. I'm going to be talking to people and interacting with people in person on a daily. That's going to be my career. And I would have never even thought about that before Nuvia. I didn't talk to anybody. I hid. And now I'm making a podcast with you and laughing and smiling, like, look at me from the side.
Exactly. And it just, you went through so, like, we've talked in another podcast about this, about all the trial and errors that you went through of trying to fix your smile, right? And you finally have something permanent. You finally have something you can use and not have to worry about. Like, that is amazing. Like, oh my God. And you've stuck it out through all of that.
And it's literally, even though it's been almost 4 years, I'm still seeing things that show up in myself because of my teeth. The kind of person I am, the way I show up, the way I interact with people at work, the way I interact with strangers in the store. I'm like, hey, how you doing? I get to be the person I knew I was meant to be, that I could feel that I was meant to be, but I couldn't because I was hiding behind not being able to smile or talk. It's so huge.
That's like part of the point of this video, right? It's like, it's not just a quick overnight change, where it's a transformation. It's a transformation of your life. Like, and it's not just the smile, it's everything that the smile encompasses, you know?
Yeah. Absolutely.
Wow.
Well, and I watched the Nuvia video that they did on me before my surgery. Like, they did like this, interview with me before my surgery, and I've watched that with my children since then, and they're just like, oh my gosh, Mom, I don't even remember you that way. You, like, the way you talk, the way you pronunciate. She's like, you look so much younger now. There's a brightness in my eyes, the way I show up. Like, I am a completely different person than I was 4 years ago. And it's so weird how just you don't think teeth make that big of a difference, but they do. They do. That's huge. Huge. It's like I can't even put it into words, the changes that come with it. My own children, who have known me my entire life, cannot believe that was me compared to how I am now, because it's,
wow.
I shine, and it's because I can smile and talk and show up, and sometimes I'm really silly. Like, I don't even care because it's fine now. I don't have anything to hide from.
Exactly. Oh my gosh. That makes me so happy. It's time for You Ask, They Answer. These questions come straight from the Nuvia Smile Maker Club on Facebook. And our first question comes from Cheryl. So she says, so how do you clean between your gums and prosthetic? My fear is something getting in there and can't get out. So you said you had some initial struggles with, things getting stuck in there, but can you talk about your maintenance?
I will tell you right now, there's nothing to worry about, because as much as I've gotten stuck in there, there is nothing permanently stuck in there. There are so many things you can use. For example, first of all, be clear with this. If it's in the first 4 months, don't do anything without discussing it with your Nuvia doctor. I know there's rules with the water pick. There's rules with those little, they have these little dental cleaners that have like the little Christmas tree at the end. I love them. They're very tiny, and you can kind of clean, like, you could feel like a kind of a little buildup in there. Not much. Every once in a while, just on the backs. You can't get while you're brushing. As long as you're following the doctor's orders and not eating the hard stuff, first of all. I use my water pick anytime I eat. I love it. I love the way it feels. I don't ever go above a 4 on the speed. I have accidentally turned it on when somebody else had borrowed it, and it was high, and I don't like the high speed. It's not hard to clean it out. If you have a problem, call your Nuvia office. They will never turn you away. They will guide you. If it's something that's causing pain, say something is really causing you discomfort, they'll get you in. They'll take care of you. Trust me on that, because they have for me. and I've heard numerous stories about it.
Exactly. Kamisha says, day 3, and I'm wondering if I've made the right choice or do I just need more time? I feel like I look funny and my mouth feels big. I can't chew, I can't talk. I only got my top done, but I'm trusting the process. This is so hard for me right now. So, what advice would you
Oh,
give to her?
Misha, 3 days. My husband and I can think of numerous other people that said 3 to 5 days is usually the worst. You are uncomfortable. The numbing's wearing off and you're starting to feel it. Like you could feel where they are in your mouth. Probably going to bite your cheeks, bite your tongues. Please be patient with yourself. 3 days is just like this much into the journey. Patience, 3 days is nothing. I mean, it's a big deal to you. I don't want to disregard your feelings because, 3 days, but 3 days is the number one answer I hear from people on discomfort and second guessing themselves. 3 to 5 days. Be patient, love on yourself, sleep, take care of you, and have faith.
Jeannie says, hi all, join the group today to prepare for my consultation next week, looking for pros and cons from personal experience and cost. So what advice would you give to Jeannie, Michelle?
Hi, Jeannie. My advice to you would, first of all, have a video. Go check it out on YouTube. It's got my pros and cons list. Download the cost guide. It will give you great information. There's different things you can look at. There's little scanners you can scan and get more in-depth conversation going and details on that. It's very detailed and well put together.
And that's in the description below.